Hello. In this video, I will be highlighting both the dental and medical tool parts of the Health and Wellness exhibit in the Chaska Historical Society.
Dental tools. Here, you can see a Burton's pulp testing kit. The instruments included were used to determine whether a tooth needed to be extracted or not. Doctors would send vibrations through a tooth, and if there was just a humming sound, then the tooth was worth saving. If the vibrations caused intense pain in the tooth or jaw, then it was a sign that there was damage and the tooth needed to be extracted. Here is a straight shaft tooth extractor. It was also known as a turnkey and was used around the year 1800.
The barber surgeons of medieval Europe are the forebears of today's dentists.
Barber surgeons themselves were divided into two groups: those who performed complex surgeries and those who performed simple procedures including lancing boils, bloodletting, and dental extractions. The earliest examples of instruments designed specifically for extractions are the pelican and toothkey. The pelican was first described and illustrated by French and Italian authors in works dating to 1363 and 1483 respectively. The pelican was named so because it resembled the bird's beak, with a long straight shaft paired with a curved claw which worked in tandem to remove the tooth. It was used until the early 1800s, when it was replaced by the toothkey or turnkey, which itself was replaced in the late 1800s by forceps. The key continued to be used for some time after that. The toothkey had an iron shaft and handles made out of wood, horn, ivory, or metal. When used, the toothkey was inserted into the mouth, the claw was hooked over the tooth to be extracted, and the handle was turned, as if opening a doorknob. This form of extraction could be extremely painful and often resulted in broken teeth, fractured jaws, and soft tissue damage, as well as the removal of certain teeth. Here is a dental probe and scraper.
The scraper was used to remove tartar from the teeth,
and the dental probe was used to look around teeth for soft spots and sexual infection. Here is a dental school textbook called Grant's Atlas of Anatomy from 1978. Here is a mold that was used to teach dental students what to look for when creating a bottom-endable denture. And here is an instrument that was used for measuring jaw size for creating dentures. Here is a typodont from the late 1970s and early 1980s. Ones like these were used for teaching dental students how to prepare teeth for fillings, and this was a product used by dental students to practice applying sealants to teeth. Here are some models of prosthetics and removable partial dentures. These were used to show patients what the restoration would look like. Here is a book about dental art, science, and literature that was published in 1896. And here is a sampler that was used for ordering appropriately sized gold crowns. Here is a picture of Edgar Ziegler. Known for his incredible commitment to his community and his dental profession, Dr. Edgar Friedrich Ziegler was born on February 17, 1930,
to Fred Ziegler and Elsie Littner Ziegler in Perham, Minnesota.
He graduated from Perham High School in 1948, then attended the University of Minnesota, attaining the Doctor of Dental Surgery degree in June of 1954. Ziegler married Ruth M. Doublefirth on June 19, 1954. He served as a captain in the United States Army Dental Corps from 1954 to 1956, stationed in Germany. Dr. Ziegler held a private practice of dentistry in Chaska, Minnesota
from 1956 to 1994.
In addition, he served as a clinical instructor/professor in School of Dentistry at the University of Minnesota from 1962 to 2010 and was full-time faculty from 1995 to 2010. Beyond his numerous commitments to his profession, Dr. Ziegler served as a mayor for the city of Chaska from 1968 to 1974, during a time of extreme change for the community.
He was a recipient of the Rotary Club George C. Klein Service Above Self Award.
After his death in 2019, he was buried at Fort Snelling National Cemetery in Minneapolis, Minnesota. Medical tools.
Here is a microscope that was used by Dr. George T. Schimmelpfennig.
Here are some forceps that were used in surgery. Here is an autoclave. This was used to disinfect metal syringes with super hot water. Metal syringes would be attached to a glass sealed tube that would contain the medicine. The metal syringe would then force the medicine out of the glass tube and into the patient. Metal syringes were liked by doctors due to the ease of sterilizing them by boiling.
This doctor's bag was found in Dr. Schimmelpfennig's office
and may have belonged to Dr. Hartley, who practiced in the late 1800s and early 1900s. Here are some syringes that were found in the bag. Here is a surgical kit that would have been used from 1880 to 1920. Medical doctors in rural areas in the late 1800s and early 1900s showed an amazing willingness to undertake difficult operations. Sometimes they were successful, sometimes they failed, but they and their patients knew that the alternative, without an attempt being made, was hopeless. Dr. Hartley encountered the situation when he arrived one evening at a home where a man was experiencing severe abdominal pain. Hartley diagnosed it as appendicitis
and performed an emergency appendectomy
with the man lying on a kitchen table by the light of a kerosene lamp. The patient fortunately survived. Dr. Hartley served the people of Chaska and Carver County for half a century, weathering through epidemics
of diphtheria
and typhoid fever. In 1901, smallpox struck the town, fortunately with no deaths. Dr. Hartley was involved in vaccinating over 400 children during this outbreak. His name has faded from memory over the decades, but his 50 years as Chaska's doctor has earned him the title of
beloved old family doctor.
Thank you for watching.